after Princess Catherine, or the Duchess of Cambridge, Catherine, stepped out for the first time since the birth of baby George, rumours have been rife about her post-baby body, with many putting it down to diet and exercise. Some say Kate has undergone a mummy makeover.
Oh, Princess Catherine isn't the only new mum to step out with a slim frame shortly after the birth. Kim Kardashian has also sparked rumours of a surgical makeover. And with Aussie mums spending up to $20,000 a year each on surgery, we have to ask, what exactly is a mummy makeover? That's what we're going to do now.
OK, well, to explain their growing popularity, we're joined by plastic surgeon Dr. Kourosh Tavakoli. Good morning to you.
Morning.
What exactly is a mummy makeover?
Mummy makeover is a combination of breast augmentation surgery and really a tummy tuck, and sometimes a little bit of liposuction that sort of constitutes a mummy makeover.
What are the stats on this? How many mums on average are coming in and asking you to have work done? Is there an increase? You see an increase?
I think there's been a huge increase in mummy makeover purely because of all the media attention. But I think it's important to highlight mummy makeover can't happen straight away. It's got to be a process. And the process is weight loss and exercise and diet, and a period has to pass, roughly 2 years, and then we can start, talking to the plastic surgeon about ways to enhance the body.
Oh, OK, so why that 2-year gap? Is it for your body just to recover, for everything to get back to where it should be?
Yes, Kylie, I think the 2 years is necessary to allow the physiology of post-pregnancy to settle down, the body to go back to normal.
Sure.
Also postnatal depression, all that kind of stuff has to pass.
Yeah. So probably to suggest Princess Catherine's done it after 5 weeks would be...
No.
No way.
No, I think it's all media. Like, I think she had a great figure to start off with, and, she watched her diet, and probably she's got a whole team of personal trainers and dietitians on standby, and there's no plastic surgery. I'm afraid. It's all natural.
We said in the intro that Aussie mums can spend up to $20,000 a year on this sort of activity. What costs? What price tag are you putting on this?
I think it's around 20,000,
Wow.
Larry. I think it's a combination of rising cost, implant cost, cost of actual hospitals. We won't get change out of 20,000 if you want the whole package.
OK, alrighty. Plastic surgery obviously sometimes comes with complications. What should people know before heading down this path?
A lot of research, a lot of understanding. You've got to understand what you get yourself into. There's complication here, overseas. You just got to pick your surgeon, pick your hospital, and something does go wrong, the team's got to be on standby to fix it. A lot of the complications are minor and can be rectified, but there's definitely complications with all types of cosmetic surgery.
There is, of course, an argument every time we have this conversation about people saying, well, new mums should just embrace their beautiful new bodies and that's the way it is. What are your thoughts on that? Should we be encouraging mums to go in for these mummy makeovers?
Well, Larry, it's not for you and I. We've got to ask Kylie that, but I think... I think what we say, it's you got to embrace what you've got, but if you want to sort of go one step further, and if you're dedicated to your diet and exercise and Pilates, and you are looking good, but you've got extra skin you can't get rid of, or the breasts have deflated to a point that you really can't, you don't feel confident about your body, then why not? As long as it's done, for the right reasons.
OK, and you've got some of these in. This is just to show
a combination
us. When you talk about breast augmentation, this is what we're talking about, right?
Yeah, we're still talking about breast implants until fat grafting becomes mainstay. It probably takes another 10 years.
Right.
For now, we're using implants, a combination of the teardrop, Kylie, and round, depending on the type of breasts we're dealing with.
So this is what we're holding here would be a C, a D cup? What's this?
That's a C cup.
That's a C.
What do most people get?
C to D.
C to D? Okay.
Yeah.
C to D is the most popular.
Most popular, yeah.
Now, have they changed lately? Like that, it's a felty feel to it. There's like
we've got these fairy ones which have become quite popular lately, but there's some limitation using them, and there's some limitation using these. I think they all have pros and cons. There's no perfect implant, but they have improved immensely. The science of implant surgery has improved a lot in the past 10 years.
What has improved? What has got better? Is it the quality of the filling? Is that...
The filling has improved, Kylie, and the shell. those are the two areas there's been huge amount of improvement. And our understanding as surgeons how they behave, the interaction of the implant with the body, which is a very complex physiology, has improved.
I can imagine. Yeah.
Okay, we've got some tips before we go. If mums are considering a makeover, when's the right time? When's the right time to have that?
The right time is when you're psychologically ready for a big transformation. 1 to 2 years after birth, you've tried exercise and diet, and you've really stopped having more children. Is probably the best time to consider a mummy makeover.
All right.
Okay.
And looking at the bank balance too. And starting if you've got that. Fantastic.
Right. Great tips, thank you.
Thank you very much.
Thank you, Dr. Kourosh.